Grazie. Hi, Elio. Thanks for coming on to Radio Italia Adelaide.
Hi, Antonio, and hello to all the listeners. Thanks for having me on.
I introduced you as an academic at the University of South Australia in the field of medical radiation.
That's it. Yeah. So,
Explain to us, what does medical radiation mean?
yeah. So, medical radiation is a very massive industry in Australia and around the world. It's a core component of healthcare. So, I'm sure you and the listeners have, at some time in the past, or even more recently, have needed medical imaging in some form, whether it's an X-ray or a CT or an ultrasound or something like this. So I guess a massive part of the healthcare landscape is medical radiation, and my role is specifically within medical imaging. So uh, you know, there's different types of radiation that we use, and one of the advantages of using radiation is that we can image parts of the body. And so that's where my role is at the University of South Australia, and also clinically I work at some Jones radiology sites across Adelaide as well.
Yes, well, I've had occasion to have some imaging done recently in a couple of levels. Actually, one was something they call a PET scan, which I thought was quite interesting. I had to drink a very sweet liquid full of glucose to see when it lights up. And it was the doctor said, want to see if it lights up like a Christmas tree.
That's right.
Thankfully, it didn't. But
yeah. Well, PET scan is one form of imaging. It's one more, I guess, specific form of imaging called nuclear medicine. So this is imaging which doesn't just look at anatomy, or I guess parts of the body, but looks at function. So different cells in the body behave differently, and some cells in the body, when they're behaving abnormally, will light up on a scan, and that's what the PET scan does. So yeah.
Yeah, that's to see how much activity is happening. So, okay, so you've explained to us that you use radiation to produce images. So does that mean we put radiation into the body? And
yeah, not necessarily. Radiation is all around us. Even visible light, the light that allows me to see you and you to see me is radiation. And so it's quite instantaneous. So if you take an X-ray, for example, that X-ray is essentially a packet of light that essentially just diminishes after you use it. Other forms of radiation do linger around. It just depends on the type. In medical imaging, generally low doses are used, and the benefit to the patient outweighs the risk of the radiation. So it is beneficial in that sense, and the dose is quite minimal.
Right. So it's fairly safe, and as you said, the risk is outweighed by the benefit of getting the information.
That's right.
About the patient. So you said, as an academic, you do both teaching and research.
Yeah. So
what's the teaching? Let's talk about the teaching part and see what happens.
So I teach into the Bachelor of Medical Radiation Science, Medical Imaging at UniSA. Essentially, this is producing the next generation of medical imaging technologists. So whenever or your listeners have been for an X-ray or an MRI or a CT or something like this, there's a person there, a professional, that takes those images, evaluates those images, and cares for you in the process. So it's a 4-year degree at UniSA, and that's what I'm involved in there in the teaching side.
Fine. So you're training the people who use those machines, inject or whatever the radiation into the people.
That's right.
And produce the images. Is there a lot of demand? Are there a lot of students in these degrees?
It is. If you look at admission ranking, or ATAR, it's probably one of the highest in South Australia, and if not Australia widely as well. And it's mainly because there's a huge, I guess, in healthcare all round, but in medical radiation particularly, there is huge shortages, and there is a lot of demand from students coming out of Year 12, or or in other careers that want to switch careers. A lot of demand for this type of role. So I guess, yeah, it is quite a competitive field to get into for those who are interested to get into. But once you're there, it really is an interesting and very rewarding role as well.
Yeah, and is it very theoretical, or do people get to play with the machines and
Yeah, so
do things?
that's a good question. I guess, as with many university degrees, it's uh, I guess the beginnings or the fundamental start of the degree is quite theoretical. But the benefit of health degrees is that there's a lot of clinical hours involved, and
Hmm.
so you really get hands-on within the program, working at hospitals and radiology clinics across not only South Australia but nationally and particularly in rural areas that really need students and radiographers. So yeah, very very hands-on degree. And I guess it has to be because you don't want to produce, graduates who have never, been in a hospital
Yeah,
or who haven't had that type of experience, particularly because, you know, the, there's patients involved. It's life or death situations, and you don't really want our graduates to have that or have a deficiency in clinical experience when they graduate.
yeah.
Mm,
Okay, that's an important aspect. So you want the people who graduate come out from the university and knowing how to make the images, use the machinery, and inject or whatever the radiation
that's right.
into the patients. Elio, we talked a bit about the teaching that you're involved with at the University of South Australia. How's about research? That's an important other area of activity that
Mm.
academics are involved with.
Yeah, so I guess in my role as an academic at the uni, there's the teaching side, but I also have the opportunity to do research, and we have a couple of projects going on at the moment. But one of the major ones that we're doing is we're trying to explore the long-lasting effects of some drugs, particularly methamphetamine use, and
Oh,
its effect on the brain. Because what a lot of people don't know is that methamphetamine use has links with Parkinson's disease. So I'm sure
oh.
some of your listeners may have experience or family members or friends with Parkinson's disease. So we're really looking quite closely at that relationship in this particular research that we're doing.
What does that mean? The how methamphetamines cause Parkinson's, or are you
Yeah.
using it
So
as a cure?
so how it or causes or correlates with
Yeah.
Parkinson's. So the same part of the brain that Parkinson's is affected by, and the same cells called dopamine, uh,
Mhm.
is, it can be affected by methamphetamine use. And so, um, although I guess people using these types of drugs don't realize at the time, there's not much research into what happens many years down the track. And so, some of the issues that we see in Parkinson's disease, we're also investigating if we see those same issues in methamphetamine, people who have used methamphetamine just a handful of times, not necessarily people who use it constantly, but only just a handful of times. So um, our research is involving taking images of the brain using ultrasound and also MRI, as well as some other tests to determine some of the links there between Parkinson's disease and the use of methamphetamine.
By the way, this word methamphetamine, is there a smaller and easier word?
Yeah, so people will often call it ice. So that's the other, I
Yes.
guess, the more commonly used word in the media that gets said. So methamphetamine, meth, or ice. Mm.
Okay, so those words we hear quite a bit. How do you find people to participate in this?
Yeah, it is
Are you
a
going to
it is a
say go
difficult,
out? Do you go around people saying, "Are you taking ice?" And we,
not quite. We do recruit both control groups, so people who have never used the drug, and then people who have used it before. And there's a few different avenues we can use. So online is a good way of getting participants. Even just the old-fashioned way of putting posters up and flyers around, places like shopping centres or the universities. That seems to be quite effective. So I guess it is a difficult process, but the research, the benefits of the research is quite rewarding and impactful. So that those difficulties in getting those participants are quite worth it from our perspective, anyway.
and you're but your contribution is what? Taking the images of the brains
Uh,
and
w-
analyzing them?
yeah, so more, I guess I'm administering the entire project with with some other researchers at the university,
Okay,
and we're organizing images to be captured at some sites around Adelaide, and I also conduct some of the clinical tests that we use to help find these links between the drug use and Parkinson's disease.
okay.
Mhm.
Very, very useful. All research is, but this has a very practical outcome and maybe can help people be careful or more careful as the case may be.
That's the aim, to raise awareness and hopefully provide some really concrete evidence that the links there.
Okay, and you're administering this project. How long was it? Well, you said it's a long term.
It's a
So
it, yeah, it is a big project, long-term project, and it'll probably be going on. It's been going on for about 6 months to a year at the moment, and it'll probably go on for another year or so. So quite a long-term project, but I guess nothing impactful is made without kind of a long-term method. So yeah, still a bit to go, but we're getting there.
yes, the impact of ice on the brain through well, eventually to Parkinson's or Parkinsonism. Aha. And is there a reason to think, as you said, it impacts on the same part of the brain that is affected by Parkinson's?
Yeah, that's right. So I guess we know a lot about what methamphetamine does in the short term to
Mhm.
people, but that long-term effect, very little research in. So that's what we're trying to find out with this research.
And other interesting research projects that are going on in your area
Yeah,
that
so
you're doing?
yeah, I guess being at the involved with education, there's a lot of research going on to how to improve effectiveness of our teaching
Okay.
within medical radiation, but in healthcare in general. So we do a lot of work with simulation techniques. So this is, I guess, to simplify it would be to put students in the shoes of someone working in a hospital without actually them being in a hospital, if that makes
Mm-hmm.
sense.
Yeah.
So kind of acting as a stepping stone between the classroom and the hospital itself. So that's some of the research we have going on. We also do some research with, I'm sure you might be aware of, it's not a new thing, but it's certainly gained popularity, but the term artificial intelligence. So
Yes.
looking at AI and how it can be used in radiology or medical imaging to improve our work and hopefully improve patient outcomes at the end. So helping our patients recover better and quicker.
Yes. Okay. I've had reason to look into radiation for therapy purposes, not for imaging, apart from, as you said, having had a PET scan recently, which
Hmm.
might give a bit of a hint as to what's going on. Um,
Yeah,
but it seems like a promising area. It's been around for a long time and might be less toxic, better than chemotherapy better in some respects. Um,
yeah. So
hopefully.
radiation therapy is one area that we also teach at Uni SA. So it's one of the topics within medical radiation as a whole. So I'm mainly within imaging, which is
Yeah.
using radiation to diagnose things like broken bones or cancers and that type of thing. Whereas radiation therapy is using that same radiation to actually cure things like a tumor, for example. And so there's a lot of research being done at UniSA in that field as well. Not my area
Yeah.
particularly, but it's yeah, some really exciting things happening there as well.
Yeah. Okay. Well, now it's time is going on. Let's move on to your Italianness. Now, Arruzza. By the way, looking at your Facebook profile, I in your photo, I recognize one of the people in your photo
Yeah,
going around the Italian community. So, where does this name come from?
yeah. So I'm what you call a second generation Italian. So or Italian Australian. My parents were born here. My grandparents came in the 1950s and 60s. So my father's side came from Calabria in an area a village called Arena, which is near, I think, Vibo Valentia or Catanzaro,
Okay.
around that area.
Yep.
And my mum's side came from a town called Anzano, so that was near, or province of Foggia in Puglia. So, yeah, they came in the 50s and 60s. And yeah, I guess I've always had a close relationship with my family, and growing up, they were around, and yeah, really close relationship there. Um, I guess I probably didn't know it at the time, but I grew up in the western suburbs of Adelaide, and
Yep.
I went to St Michael's College at
Okay.
Beverly and at Henley Beach, and it was a very multicultural school, but particularly had a large influence from Italian culture. We learned Italian there. A lot of the students and even the teachers I was at school with were Italian Australians. So yeah, didn't really realize that at the time, but yeah, massive Italian influence just at school. So yeah, always around Italian Australian culture, and yeah, I guess that's my Italianness
Okay.
there.
So we should have done this interview in Italian. What do you think?
Oh well, no. Well, with being second generation, it hasn't quite the Italian hasn't quite got to me. I was going to say at the start, mi dispiace mio parole di italiano non è basta per intervista con te. So that's about my limit of
Okay, no,
Italian.
that's
So
cool. Excellent. And what about Inonni? So you said regional background, Calabria and Puglia. Have
that's
you
it.
been? Have you been to Italy? Have you
I've never
visited?
been. No, never been.
Okay.
I'm planning to go in the next couple of years. They're both sets of well, um, one of my grandfather's passed away, but three of my grandparents are still alive, so they're always telling me
Okay.
about how it is there, and or how it was there, and yeah, very keen to go there in the near future. So yeah.
Well, that is an important influence on people's lives. It's interesting. We're talking about something similar with the professor who's now a professor, or was a professor at RMIT. And she was talking about how, in fact, growing up, probably the culture, the background was different from the mainstream, but whatever the mainstream is in Australia, because,
Mm,
as you said, it's a very diverse society, and you know
yeah.
what you know, what you grow up with. It does
Mm,
have a strong, lasting impact on how you
that's
see life.
right.
Yeah.
Yeah. I guess you don't realize at the time, but probably growing up, you're in a bit of a bubble, and I certainly was. I thought that growing up in that environment was Australia until I kind of
Yes.
got out a bit more, and went to uni and started working, and realizing we're a lot more multicultural than what I thought. So, but nonetheless, a great upbringing, and yeah, feel like it's been a real privilege to grow up in that type of environment and with the culture I have. So, yeah.
Yeah, and it's good to see like people like you. They're kind of doing interesting things in the academic right. In fact, just a couple of days ago, I went to an event organised by a CRC, where Professor Frank Bruno of UniSA, is the organising the South Australian chapter, and he's in the past received a Eureka Award for innovation. So
Excellent.
it's good to see that presence in doing very interesting things in the professional sense. Thank you, Elio, for coming on to Radio Italia Una Adelaide, and good luck. It's very interesting research, and good work teaching the next generation of radiographers.
No worries. Thanks, Antonio, for having me. And yeah, it's been a pleasure talking about the teaching and the research that I've been doing. Thanks a lot.